Hey beautiful people, and welcome back to my channel. So basically what happened yesterday, I had gone to dialysis early session because I was going to start with a new treatment. Well, I did. So I went to the early session of dialysis, and then my dad picked me up and we drove to Olivedale where the hematologist is. So we went in and we first had to take bloods just so we knew where my levels were at, and then we waited a while for the results. My platelets were sitting at 177, which is really good for me, and my hemoglobin was sitting at 13 point something, again very good for me, because usually my platelets are either below 100 or just above 100, and usually my hemoglobin sits at like 11 until 9, so like it drops. So that was also very good to see that was at 13. So the treatment that we started on is called Rituximab. So now I'm not going to spew what I think it is, or like knowledge or like pieces of what I've gathered that it is. I've got an information leaflet, so I'm going to read from this just so that we have all our facts straight. So Rituximab. Drug type Rituximab is a monoclonal monoclonal, I don't know, antibody. Okay. What is Rituximab used for? Treatment of certain types of non-Hodgkin's lymphoma or treatments of chronic lymphocytic leukemia. Note, if a drug has been approved for one use, physicians sometimes elect to use the same drug for other problems if they believe it might be helpful. How Rituximab is given. It is given as an infusion into the vein for over about 6 hours, especially for your first session, which for me, we actually did less than 6 hours because I was doing so well, but I'll get more into how, like, my whole experience with the first session and everything. I just want to read through what the drug is about and everything like that, and then I'll get into my experience with it. The time of the infusion may be shortened depending on whether or not you have received this drug in the past or how well you tolerate this drug. So again, for me, I was tolerating it pretty well, so we didn't do 6 hours. I think we did it like in 3 or 4 hours, but then the next sessions we can do it even less. Medications may be given just before the infusion to reduce the occurrence of infusion-related symptoms. So yes, firstly they have to hydrate you. So usually they would give a person a litre of just normal saline, but because I have renal failure, I've got fluid restrictions, they only gave me 200 mils. And then the next medication they gave me was an antihistamine. They only gave me half the dose because it would obviously make you sleep and make your blood pressure drop and everything. They did also take my blood pressure and everything to see where it was sitting at before giving it to me, so they gave me half. They also gave me cortisone. Luckily I didn't take my cortisone yesterday because I don't take my medication just before dialysis because there's no point, because the dialysis machine is going to wash it away. So luckily I didn't take my cortisone because they gave me a different type of cortisone on just before with the treatment, because she says it helps the body absorb the drug Rituximab better or something. So luckily I didn't take my cortisone. Yes, there's no pill form of Rituximab. Okay, the amount of this medication you will receive depends on many other factors, including your height and weight, your general health and other health problems, and the type of cancer you have. I don't have cancer, just before anyone starts to freak out. I don't have cancer. This drug is very similar to chemo, but I don't have cancer, just so we're clear on that. Your doctor will determine your dosage and schedule. Side effects. Important things to remember about side effects of rituximab. Most people do not experience all the side effects listed. Side effects are often predictable in terms of the onset and duration. Side effects are almost always reversible and will go away after the treatment is complete. There are many options to help minimize or prevent side effects. So again, that's why they gave me an antihistamine, because some of the side effects that the nurse explained was back pain. So they did also give me Panado before we started anything. Back pain, shortness of breath, tight chest, or even an itchy throat. During the treatment, so obviously I fell asleep because of the antihistamine, and then I woke up during the treatment and my throat was very itchy and my chest was starting to get tight. I've never experienced that before. Never, ever, ever. So now when I know when people get an allergic reaction and their throat gets itchy, I now understand what they mean. So obviously I like called her over and told her, and then she was rushing around, and then she got the second half of the antihistamine because she only gave me half before the treatment. So she switched over the IV to the antihistamine, let that run through, and then after 3 minutes I was starting to get better and everything like that, and then she continued with the rituximab. There is no relationship between the presence or severity of side effects and the effectiveness of the medication. The following side effects are common, occurring in greater than 30% for patients taking rituximab. Fevers and chills, see flu-like symptoms. So she said, the nurse did say to me, I can experience fevers and flu-like symptoms, and then she did also comment that it's kind of terrible, especially now with the whole coronavirus outbreak and everything, because at dialysis they do check your temperature and everything like that. So I'm going to have to explain to them and even bring this saying, if my temperature does go up, I'll just be like, it's one of the side effects of rituximab. The following are less common side effects, occurring in 10% to 29% for patients receiving rituximab. Weakness, nausea, headache, cough, runny nose, shortness of breath, sinusitis, sore throat irritation. A serious but rare side effect of rituximab is potential for a severe infusion reaction. Typically, with the first infusion, during the infusion or within 30 to 120 minutes of infusion, you will be given medication prior to the infusion to decrease this reaction and monitored carefully during the infusion. If signs of reaction occur, the infusion is stopped. In most cases, the infusion can be restarted at a lower rate once symptoms subside. So obviously, because I was doing so well during the whole treatment and infusion, they slowly, because obviously when you first start, it has to drip very slowly. And then obviously if you're doing well, because they do monitor you, if you're doing well, then they increase it so it drips a bit faster, and so on and so on and so on. Other rare but serious side effects. Patients who have had heart pain or irregular heartbeats in the past may experience this again. If these occur, tell your doctor or nurse so that can be treated. Rapid destruction of cancer cells can cause disturbance in metabolism, leading to kidney problems. I've already got renal failure, so nothing to worry about that. If you have questions about this information, ask your doctor. Okay, next page. Note, all side effects are listed above that are uncommon, occurring in less than 10% of patients are not listed here. You should always inform your healthcare provider if you experience any unusual symptoms. So there are some symptoms that do occur, but they haven't listed it. Okay, when to contact your doctor or healthcare provider. Contact your healthcare provider immediately, day or night, if you should experience any of the following symptoms. Fever of 38 degrees Celsius or chills, possible sign of infection. Shortness of breath, chest pains or discomfort, swelling of your lips or throat, or confusion. So far I haven't received any symptoms at all. The only one was during the treatment, but that was sorted with the antihistamine. But when I got home, obviously when I got home I was tired, but that was because of the antihistamine, which just makes you tired and sleepy and everything. So I slept through the whole treatment. When she woke me up and she says, you're gonna finish soon, you're gonna finish around 5:30, because we got there and we waited quite a while. So I was like counting 6 hours. I thought we were gonna end around 8, but obviously I was doing so well. So when she said 5:30, I'm like, okay, wow. And then she says, do you want to give your dad a call? Because my dad, obviously there's no Uber at this time. My dad is obviously driving me to dialysis and back and wherever we need to go. So she said, do you not want to call your dad? Because my dad had said, call me just before like half an hour before the treatments is done, because we're in Stanton, Olivedale's a bit of a drive. So, any case, the following symptoms require medical attention but are not emergency situations. Contact your healthcare provider within 24 hours of noticing any of the following: develop a rash or sore joints, nausea, interferes with ability to eat, and unrelieved with prescribed medications, vomiting them more than 4 to 5 times in a 24-hour period, other signs of infection, sore throat, cough, redness or inflammation or pain when urinating. Profile, nothing. Always inform your healthcare provider if you experience any unusual symptoms. Okay, precaution. Before starting Rituximab treatment, make sure to tell your doctor about any other medication you're taking, including prescription, over-the-counter vitamins, herbal remedies, etc. She already has my script. She's been in contact with my nephrologist, so she knows all the medication I take and all that kind of stuff. Do not receive any kind of immunization or vaccines without your doctor's approval while taking Rituximab. Inform your healthcare professional if you're pregnant or may be pregnant prior to starting this treatment. Nope. Pregnancy category C, use in pregnancy only when benefit to the mother outweighs risk to fetus. For both men and women, do not conceive a child, get pregnant while taking Rituximab. Not planning on that. Barrier methods of contraception, such as condoms, are recommended, blah, blah, blah. Discuss with you. Okay, yeah, I'm not planning to conceive or anything. Do not breastfeed. Again, I'm good. Self-care tips. Rituximab may cause temporary low blood pressure. If you're taking medication to reduce your blood pressure, check with your doctor or nurse as to whether you should take it as usual or not before the infusion. I'm currently not taking any blood pressure medication because my nephrologist has stopped it, because my blood pressure seems to be on the normal side. Like, it's not too high and it's not too low. So currently I'm not taking any. You may experience shortness of breath, feel flushed or dizzy during the infusion. I was just tired and uncomfortable because so the whole area, you will see in the clips, because I did take a small clip, there's a lot of recliner chairs, and that's where like different people, because some people receive like other infusions and stuff like that. So there's recliners and everything. I was on a recliner. It was comfortable in the beginning, but because I wanted to sleep, like, I would have preferred like a pillow or blanket, but because of the whole coronavirus thing, there wasn't any. So I don't think the next infusion will be too long, but if the antihistamine makes me tired again, I think I might just bring a pillow just so I'm a bit more comfortable for the next one. Okay, yes. You will most likely receive medication before the infusion. Yes. For flu-like symptoms, keep warm with blankets and drink plenty of liquids. There are medications that can help reduce the discomfort caused by chills. It just says drink 2 to 3 quarts of fluids for the first 48 hours after each infusion. Okay, I wasn't told to drink fluids or anything, unless you were told to restrict your fluid intake. Okay, I wasn't told to drink anything or restrict anything, but obviously I think it just applies that because I'm already fluid restricted that I shouldn't. And plus the bag that the Rituximab was in was a big bag. I think it was 1 liter. So yeah. This medication infrequently causes nausea, but if you should experience nausea, take anti-nausea medication as prescribed by your doctor. and eat small, frequent meals. Sucking on lozenges and chewing gum may also help. You may experience drowsiness or dizziness. I was just tired straight after. My dad picked me up. The sun was setting, the moon was out. It was actually very pretty. We did stop by one of those express Woolworths by the garages to pick up some dinner and stuff like that. So yeah, and then we got home and cooked and everything. The power did go off a bit last night and then came back on. Okay, it went off while we were cooking the chicken. I think the chicken needed like another 20 minutes to go. And now we're like, oh, what are we gonna do? So then my dad told my brothers to start the fire. And then he started the fire, and then a couple minutes after that did the power go back on. So yeah, the power came back on, so we put the chicken back. Well, the chicken was in the oven, so we just made sure it was cooking, and then we had a little fire. Because I mean, what can you do? You can't just like, well, anyways. Avoid driving or engaging in tasks that require alertness until you respond to the drug. Your response to the drug is known. So obviously they did say that I would have to have someone to drive me and stuff like that. So I do also have a what would you call it? A permit to say that I'm going to go to this place for such and such. So yeah, if they have any problems, they're more than welcome to contact whoever. So I do have that. My dad's name isn't on it, but obviously if they do stop us and say, why are you driving her, we can always say, listen, she's not allowed driving. Plus I don't know my drivers. If they have a problem, they're more than welcome to contact the number on there. Because I also have one for dialysis, so my dad keeps that in his car. Okay. Yes. Not allowed driving. Okay. In general, drinking alcoholic beverages should be avoided. You should discuss this with your doctor. Yeah. I mean, I do have like I had on my dad's birthday. Not too much. It's only for special occasions that I do. But obviously during the whole treatment, which is going to be the next 4-ish weeks, I'm not going to. So yeah. Maintain good nutrition, of course. If you experience symptoms or side effects, be sure to discuss them with your healthcare team. They can prescribe medications and or offer other suggestions that are effective in managing such problems. Okay, monitoring and testing. You will be checked regularly by your healthcare provider while you are taking Rituximab to monitor side effects and check your response to therapy. Periodic blood work to monitor your complete blood count, as well as the function of other organs such as your kidneys and liver, may be ordered by your doctor. Kidneys are done, so it doesn't really matter, but it's obviously best to still check just in case there is infection or like anything. How Rituximab works. Rituximab is classified as a monoclonal, antibody. Okay. That word, antibodies, are a relatively new type of targeted cancer therapy. So it's a new type of cancer therapy. Antibodies are an integral part of the body's immune system. Normally the body creates antibodies in response to an antigen, such as a protein in a germ, that has entered the body. The antibodies attach to the antigen in order to mark it for destruction by the immune system. So basically what my body is doing is attacking my own cells. So something is wrong there, so yeah. To make anti-cancer monoclonal antibodies in the laboratory, scientists analyze specific antigens on the surface of cancer cells. Then, using animal and human proteins, they create a specific antibody that will attach to the target antigen on the cancer cells when given to the patient. These antibodies will attach to matching antigens like a key fits a lock. Since I don't like this word, monoclonal antibodies target only specific cells. They may cause less toxicity to healthy cells. Monoclonal antibody therapy is usually given only for cancers in which antigens and their respective antibodies have been identified already. Rituximab works by targeting the CD20 antigen. I don't know what CD20 is. Okay, doesn't really say. I'll Google it just now. Okay, targeting the CD20 antigen on normal and malignant B cells. Then the body's natural immune defenses are recruited to attack and kill the marked B cells, stem cells. Then the body's natural immune defenses are recruited to attack and kill the marked B cells. Okay. Stem cells, young cells in the bone marrow that will develop into various types of cells, do not have the CD20 antigen. This allows healthy B cells to regenerate after treatment. So yeah, basically what we're doing is just getting rid of the antibodies that are in my body that are currently attacking my cells. Because again, with the results of my bone marrow biopsies and everything, my body is producing all the cells it needs to. It's obviously not producing as much as it should for my age and my weight and my height and my gender and everything. So basically we're just going to attack the cells, attach to the cells and attack the cells that are attacking my cells. And then obviously this isn't going to affect my bone marrow that's going to produce new cells. So it's not going to affect those new cells. So then my bone marrow can now produce healthy cells. Yes. Okay, this allows healthy B cells to regenerate after treatment. Okay. Note, we strongly encourage you to talk with your healthcare professional about your specific medical condition and treatments. The information contained in this leaflet is meant to be helpful and educational, but is not a substitute for medical advice. And then obviously all the information that they got for this leaflet comes from the website chemocare.com. So Chemocare is designed to provide the latest information about chemotherapy to patients and their families, caregivers and friends. Okay, cool. So that's the whole leaflet. So Rituximab is quite the treatment, quite the drug, but so far I haven't had any symptoms or anything like that except for when my throat was itchy, but that was because I was only given half the dose of the antihistamine. So yeah, I will obviously post another video regarding the treatment with the last session. So with this treatment, I was told I'm only going to get 4 doses because that's one cycle. So obviously I did one treatment yesterday. So I'm going in again next week Tuesday, not Monday, because Monday's a holiday and I don't want to be admitted. And they also don't want to admit me because it's only going to be like 3 hours and then I'm done. So I'm going to go early-ish. So she said around 8ish, 9ish on Tuesday. And then, yeah. The reason why we did it on Monday, we did it yesterday, is because we wanted to spread out the dialysis sessions as much as possible, just so my body, the drug can be absorbed and everything in my body before I go to dialysis, because we don't want dialysis washing out the medication, because then what's the point? But it's fine if I need to. But so she didn't really say anything, the doctor, but if I need to, then I'll always just arrange to go to dialysis Thursday morning instead of Wednesday afternoon. But I'm sure it would still be fine because I'll have the rest of Tuesday and like most of Wednesday before going to dialysis. So I'm sure it's fine. If she had a problem with it, she probably would have asked me if there's something we could have done. But then I think after that, I will go on the following Monday and the Monday after that. So basically for like 4 weeks, which is a month technically. So with my last session again, I'll probably do like an update after the treatment and everything. If I do like notice like any changes in my body or this or that, I will like maybe pop in with a small video everything, but Otherwise, I think I'll just update you with the last treatment. Also, I don't know if I did update you that I'm taking 12 tablets of cortisone, which is 80 milligrams of cortisone. I was told I must now take 10 tablets, so that's 60, no, 70, yeah, 70. So I think we're gonna drop by 10 milligrams every week, which is cool because I can't wait to be off cortisone. Because I definitely picked up weight, because I can't, when I go to dialysis and the amount of fluid that's supposed to be taken off, I can't take off that much. Yeah, so my dialysis session yesterday wasn't the best, so I had to reduce the fluid, even though it was actually already reduced. So yeah, I'm gonna have to increase my dry weight for now, and then when I'm off cortisone for a little while, then hopefully we can lower my dry weight again. It's not fun picking up weight, but it's because of the medication, so I'm not going to let it affect me emotionally. I mean, obviously I will be affected a little bit, but for the majority of it, it's out of my hands. So that's what I'm going to say. If it does affect me, I'll just say it's out of my hands. So yeah, what else? What else can I update you on? I'm still busy with my room, so that's why you see, sorry, the camera cut. My storage decided to give up on me. So yeah, I don't think there's anything else to update you on. Oh yes, the reason why you see my cupboard is because I haven't done anything to my cupboard. I'm still very, very busy with organizing and redoing my room. I did paint the wall, which I don't want to show you because I want the big reveal surprise and everything. I do have shelving that still needs to go up. Once the shelving is up, I think I'm like basically done, because for me the one big thing is storage, because I do have quite a bit of stuff. A lot of the stuff is like decorative pieces, so obviously you need some surface area for that. I do want to redo the pictures on that wall, because I did hang up some stuff, but I'm not too happy with it, as well as the wall by my door. Again, not too happy because there's a lot of nails and stuff, and I have to redo some of the paint. I'm gonna have to repaint the walls because there's obviously chips and everything, so I'll obviously fill in the holes where the nails were and then sand down the walls like I did with this one and everything like that, and then paint it. But we're gonna have to get new paint, because the paint that are on all the walls is like in the other bedrooms and stuff like that, and I don't think we have any more, so we're gonna have to buy more first. So it's still gonna be a bit of a while, a bit of a time period before you actually see the full transformation, except for, unfortunately, I didn't take a before, but I mean, I'm pretty sure I've got clips where I do explain what the room looked like. And obviously walking into it, it was just overwhelming because it was a mess. But I'm not going to get too into it because that'll be for that video. So yes, so that's all I can really say about the treatment and everything like that. Yes, so what can today's quote be before I say goodbye? What can it be? Well, not really a quote. I just say, because of the current chaos that's going on in the world, and the fact that we all are on lockdown, even though some people aren't following it. In any case, do check on your friends and family, do contact them, see how they're doing, as well as check on yourself, make sure you're doing well. Just take a moment and like think and like just identify yourself and how you're feeling and any emotions you have. And obviously if you aren't feeling great or you feel like you're suffocating in this lockdown, do talk to someone about it, because you pretty much feel trapped, because that's what it is, you feel trapped. So do talk to someone if you do feel like that. If you want to talk to me, you can send me a personal message on Facebook. I don't mind. Yeah, just check on yourself, check on your friends and family, see how they're doing, even if it's just a quick text. Yeah, please be safe. Please, 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 please be safe. And if you do go out, whether it's just for essential shopping and everything, please just wear gloves. If you do have a mask, do wear it. Some people say it's useless, but I mean, if you are sick, it's better that you're coughing into the mask, even if you're not, what's the term? What's the word? Diagnosed with corona. If it's just a normal flu, still wear a mask and rather cough into the mask than into the open air. Because even if you cough like into your arm, it still like goes like, it's still gonna, you know, any case. Check on yourself, check on your friends, check on your family. Spend time with your pets, start a new hobby, pick up an old hobby. There's so many things you can do. There's so many things. Find out what creative art type thing you like to do. Whether it's making short little videos, like, or if you enjoy cooking, maybe take a video of yourself cooking a favorite recipe and post it on Facebook for your friends and family to see. Or if you just want to do like a funny video, I'm just saying video because I like making videos. Anyways, or if it's knitting or painting or sketching or writing poetry or just anything, or take this time to declutter your house. Because I'm pretty sure there's a lot of stuff that's in your house that you haven't seen in the past 6 months or haven't thought about in the past 6 months. If you haven't, and if you aren't going to think about it or need it or anything in the next 6 months, donate it because you're not needing it. I mean, that's what I started doing with my room, and that's what started the whole, it's kickstarted me redoing my whole room. When I come into my room, it feels more peaceful, it feels open. I don't feel overwhelmed coming into here. Obviously, it's a bit of a mess now, but that's because I haven't put stuff away. So obviously, if I put stuff away and everything, then it's not much of a bother. But yeah, just like, or like if there's like a small DIY you want to do and you have the stuff with you, then do it. Do the things that you wouldn't have time to do if we didn't have lockdown. So yeah, goodbye. Hope you enjoyed this video and please be safe.